As Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Let me ask you about the numbers and the crowded hospitals and all these things we've been seeing on the news locally and nationally. Is this, excuse me, vaccine problem an issue of national distribution or local logistics, or is it a little bit of both in various places?
Well, it's all a little bit of both. Originally, the Operation Warp Speed said 20 million doses would be delivered in December, and 20 million people would be vaccinated. And they're a little bit behind, but actually not, considering that it's the holidays and that the logistics involved in transporting this frozen vaccine is a little bit of a challenge. But the big hang-up is once it gets to the states themselves. That distribution network has got to change. And as you may note later on today, 4 of the states have actually called out the National Guard or have the National Guard in training to assist with the vaccine delivery.
Let's talk about this UK variant, and they say people under 20 are more susceptible, it spreads faster, but a lot of people ask, if it's not any deadlier and it still works with the vaccine, why is it significant that this variant exists?
Yeah, that's really a very good point. And the problem is, if you take what we have now, which is out of control, and then speed up the infection rate by 50 to 70%, places like California will completely collapse. They're already rationing, telling ambulance drivers not to pick up really sick people, just let them die there. You get to the emergency room in LA, you wait in the ambulance 3 to 4 hours. Oxygen is being rationed. That's what's going to happen everywhere if this thing takes hold. So the problem is really the health system can't handle it.
Talk about what's going on between the World Health Organization and China. It's a difficult position. We want people on the ground there to see, when the next pandemic is going to start and what happened to this first one, and yet we can't anger them because they don't have to allow us to come in. So what's going on now?
Well, now the WHO plays its, nice guy, bad guy, good guy type of thing. We need an international group to go in there that's respected to figure out how this thing happened. I mean, because if we don't figure out how this happened, how are we going to figure out how the next one happens, even if it doesn't happen in China? We need to study this and figure out exactly what animal was involved and what activities led to this thing. So the Chinese, of course, don't they make up their own truth, and they have their own vision of what history is. And they're very nervous because they're afraid someone's going to come in and say, oh, it escaped from that laboratory in Wuhan or something. And then, it's something that you probably impossible to prove. And already the genetics people say that that's not the case. But they want to control the story.
Yeah.
But what can we do? We can't. There's nothing we can do if they don't let us in.
All right, let's get to some viewer questions. This person says, in your opinion, do you think it's too early for kids to go back to school without a testing plan in place?
Absolutely. I mean, it's a very sad thing. Kids do spread this, and yes, it's not any higher than the community. But especially with this variant coming, which is affecting children even more than adults or more than the regular coronavirus, we're not ready. We're in a pandemic. It's not working. I think it's too early.
All right, next question. Let's say the COVID-19 variant isn't as responsive to the current mRNA vaccines, and Pfizer and Moderna make a tweak to correct that issue. To what extent are they going to have to test out and get FDA approval again, or can they start rolling that change out immediately?
Yeah, this is a really great question. I don't know. We're going to really have to deal with the FDA. I mean, we're going to have to be in discussions with them because this is most likely going to happen, that the next generation of vaccines is going to have to be tweaked. So the vaccine, the tweaking is not, I don't think, is going to require all those 30,000 person studies to be done. It would be very difficult to do them now with everybody with the first vaccine in them already. But I think it'll be something like the flu vaccine, which changes every year, and they don't test it. They don't do another study with it. So I think it's a great question. I don't have the answer right now. It depends how the tweaking is, but I don't think we're going back to zero.
Okay, last question. Why aren't we testing for immunity before distributing vaccines? We have 20 million people who had confirmed cases, possibly 5 times that number. They have immunity. Shouldn't they be the last to get the vaccine?
This is another knee-jerk reaction that I think this person really, I think, brings up an excellent point. Why are we giving somebody with immunity, with the almost unmeasurable reinfection rate we have? Why are these people getting in a vaccine now that they probably don't really need as critically as somebody who's never had any immunity at all and has not had the vaccine?
Yeah.
I think they should have it, but they go to the back of the line.
Yeah.
They really don't need it urgently like all these people over 65 and all the people with diabetes and all these other risk factors. They're the ones that need it.
So, Doctor, we have time for one quick question, I am told. I am over 65 and live in Lake County, Illinois. I go to Florida for the winter. Can I get the vaccine in Florida, or will I have to return to Illinois?
No, you can get I don't think there's any residency requirement for the vaccine. You know, the vaccines have already been purchased. The U.S. government has bought these vaccines. It's just the delivery of the vaccines. I have not heard of any place saying you got to show that you're a citizen of a particular state. It would be ridiculous to send somebody, make them travel again to go get the vaccine. I would take the vaccine at the first place that you can get. Lake probably would be a very good place to get it.
All right. Thank you, Dr. Murphy.
Thanks,
if you have a
Doctor.
question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Have a good day.
Thank you.